My name is Jason Lombard, and first of all, I'd like to thank the organizing committee for inviting me to give this presentation today on the use of antimicrobials on U.S. dairy operations. And I'm actually with the USDA APHIS Veterinary Services Center for Epidemiology and Animal Health, and our group does the National Animal Health Monitoring System studies. So we do a different livestock commodity every year, and then we repeat on about every 5 to 7 years on the different commodities. I'd like to thank my co-authors that assisted in the development, and this is just a small number of folks that are involved in these studies. So anytime we talk about antibiotics, we have to talk about veterinarians because they're intimately involved in their use, and veterinarians are really the primary health providers and or consultants on dairy operations. And about 94% of dairy operations in the U.S. in 2013 reported that they had a veterinarian that they consulted with or on the operation on a frequent basis. Veterinarians are also important when producers are deciding what antimicrobial to select to use for certain diseases. They also assist in evaluating in the judicious use of antimicrobials on dairy farms. And then ultimately, we also want to prevent the milk and meat residues that Dr. Gordon just mentioned. And of course, all this is coming under increased scrutiny with the focus on antimicrobial resistance and how do we reduce antibiotic use in agriculture. So a couple years ago, the U.S. Food and Drug Administration, and that's the group that regulates the drugs that are used in dairy cattle and other livestock in the U.S., came out with two recommendations. One was that the drugs that are important in human health will no longer be labeled for use for growth promotion or feed efficiency, and they worked with the manufacturers that had those labels on their products, and they agreed to voluntarily either pull those products or pull those label designations off of their products and change the dosing. And that's going to take place or will be complete by January of 2017. So anything any of those drugs that are still in a warehouse or on a farm can still be used, but there will be no more marketing or no more they won't be manufacturing any more of those labels with that growth promotion or feed efficiency label. The other thing that they came out later was, about a year later, was that veterinarians need to oversee the administration of medically important drugs used in feed or water. And this is referred to as the Veterinary Feed Directive. And prior to, again, January 2017, a lot of this was being done at feed companies and feed mills. And so veterinarians in the U.S. are in for a little bit of a new road in terms of what they need to know in terms of putting antimicrobials into feed. So any of the medically important drugs that are used are going to have a veterinarian sign off on those. Okay, so the objective of this study and a small objective of our overall dairy study in 2014 was to describe antimicrobial use on U.S. dairy operations. And just to give you a little background on our study, the initial visits were conducted in January of 2014, and we contract with the National Agricultural Statistics Service to visit those dairy producers. They have the best list of dairy producers and of other livestock operators in the U.S., and they administered a questionnaire. Operations that completed that questionnaire and had more than 30 cows were then eligible to have a second visit by veterinary services, where we administered an additional questionnaire where we asked about disease prevalence and antimicrobial drug use. And my feedback from the field is that that's one of the most frustrating questions for our veterinary services and veterinarians and animal health folks to collect from dairy farms, because the records really don't allow easy access to how many cows were treated for metritis, or how many cows had metritis, how many cows were treated for metritis. When we look back over a year period. These are the states that are included. So what we do in our national studies is we rank states by the number of cows and the number of operations in those states. And then once we reach about 80, usually 75 to 80% of dairy operations and dairy cows in the U.S., that's where we make our cutoff. So that's how we determine what states are involved. We pick the top states. The addition of more states just adds more cost to our studies without really much of a benefit in terms of our estimates. This is our flowchart of our participation. we started with about 3,000 we started with 3,000 operations, and again, those are face-to-face interviews by the NAS folks. We ended up with 1,261 that completed that first questionnaire. Of those, 526 said, okay, you can send the veterinary services people out to talk to us, and then we'll decide if we want to continue with the survey. So of those 526, 265 operations completed the VMO survey. So we've got some challenges ahead in terms of participation in our studies that we're going to have to work on. So 265 operations were contributed most of the data to what I'm going to present today. So again, questionnaires were administered face-to-face, and the questions regarding prevalence of disease and antimicrobial use were conducted by veterinarians and animal health technicians. Our population estimates were generated using the selection weights and adjusted for non-response and accounted for study design. So for instance, in our study, we oversampled large operations and we also oversampled organic operations so that we could get enough numbers to actually tell a story. We used SAS software and a SAS callable software called Sudan to derive those estimates. And then we broke our herd sizes down. There's a couple graphs here where we broke it down into herd size. 1 to 29 is the very small herds, 30 to 99 small, medium 100 to 499, and then large were 500 cows or more. Okay, so one of the questions we asked is, did you administer, or that they asked, was were there any drugs that you administered to your cows that required any kind of withdrawal? And so what we see here, and this is based on herd size again, overall, over 90% of the operations with increasing by herd size had administered a drug that required any kind of withdrawal. So this could be an antimicrobial or other drug that required a withdrawal. When we asked them about milk withdrawal, it was very similar. So about 90% of all dairy operations in the United States are administering drugs and then must be careful and monitor for milk and meat withholds. So then we asked about antimicrobials that they used and what they used for resources to determine some of the parameters that we have down here. So which drug to use? The primary resource that they used by about 55% of operations said, well, we consulted our veterinarian or the label that was on the product that we were using that was created by our veterinarian. And then a little over 40% said, well, we've had previous experience with this drug, and that's why we're using or selecting this drug for this particular purpose. In terms of dose, the drug label used by about 25% of operations. Again, the veterinarian, over 55% of operations reported that their veterinarian told them what dose to use or prescribed that dose. The route, again, the veterinarian, very important, as the label and also previous experience with the drug were important as well. And then the withdrawal period, really going by the label or the label created by the veterinarian, and fairly few operations going with previous experience with the drugs. And we asked them a lot of different resources that they could use other than the 3 that I have up here, but those were used by less than 1% of operations. And one of the things, that there was a talk earlier by the folks from FAIRAD. We did ask about FAIRAD, and very few operations go directly to FAIRAD, so most of the information is passed through the veterinarian, gets on the drug label, and that's how it gets to the producer. Okay, so we'll jump into some of the results. So these are feed water medications for weaned heifers. And what I've got up here in the green is the percent of operations that use this medication, and then in the blue is the percent of weaned heifers represented by those operations. So the number one medication that was used for weaned heifers are ionophores, used by about 50% of operations and a little over 60% of weaned heifers. The next highest percent of operations used the coccidiostats, chlortetracycline with sulfa, and then so on. So overall, we had about 57% of operations were using some kind of medication in feed or water for their weaned heifers. Similar graph for pregnant heifers, and what we see is that ionophores are really about the only medication used. A little under 40% of operations, about 45% of pregnant heifers received ionophores in their feed. Medicated cows, feed medication for cows, really the only one that we have available are the ionophores. the percent of operations that used ionophores increased with herd size, with over 60% of operations with 500 or more cows using ionophores, and overall about 38% of operations used ionophores overall. So now we'll get into some specific diseases. So this is the table that these are the results from the table that I mentioned earlier. Pre-weaned heifers, we asked about diarrhea. Producers reported that about 21% of pre-weaned heifers were affected with diarrhea in 2013, and about 16% were treated. And so if we look at the primary antimicrobial, so how we asked the question was, what was the primary antimicrobial used to treat this specific disease condition on the farm? We weren't able to say, and I don't think producers would be able to tell us exactly what percent of the calves with diarrhea received this antibiotic versus the next antibiotic, unless they only used one. And we had talked to prior to this study about doing a prospective study looking at the traditional garbage can audit to get more information on specific drugs and use. And actually, interestingly enough, FDA was one of the stakeholders in that conversation, and they agreed that we probably shouldn't do a prospective garbage can audit, which is kind of interesting because based on some of the guidances that they came out with, it seems like it would be very important for us to have some baseline information before some of those guidances took place. But we've got the best information that we have, and until we go forward with a prospective study, we're really not going to have any better information from the U.S. So about 30% of the treated heifers were treated with the third generation cephalosporins, about 20% with the combination of trimethoprim sulfa, and about 15% with aminoglycosides. And then over here on the right are actually what percent of all heifers that represents. So about 4.5% of all heifers were on operations that primarily use third generation cephalosporins for diarrhea. The next most common disease, respiratory disease, about 12% of heifers affected, 11% were treated. About a third of those heifers were treated with fluorphenicol, and about another third treated with macrolides. And again, those are representing pretty close to about 4% of heifers in the U.S. Third generation cephalosporins not so commonly used for respiratory disease in pre-weaned heifers. So this graph kind of puts those together. So in addition to respiratory and digestive, and these numbers are the percent of animals that were treated in the parentheses here. If we look at by class, then we can see that the third generation cephalosporin, the primary antibiotic used to treat digestive, and over here the fluorphenicol and macrolide for digestive. Penicillin, the number one, or the highest percentage of heifers were administered penicillin for naval infection. Okay, the next one is weaned heifers. Again, respiratory, the number one disease of weaned heifers, about 8% affected. Most of those were treated. Again, about similar to what we saw in pre-weaned heifers with respiratory disease. About a third of them treated with fluorphenicol, about a third treated with macrolides, and then tetracycline and third generation cephalosporins. Same as before, just breaking this out and showing the different drugs that are used for respiratory, digestive, and other disease. Okay, cows. About a quarter of cows were affected with mastitis in 2013, and that's producer reported. And about 21% of those were treated with an antimicrobial. And the third generation cephalosporins, which makes Dr. Gordon's talk even more relevant, 50% of those cows were treated with third generation cephalosporins. So overall, about 10% of cows treated with third generation cephalosporins, about a quarter with lincosamide, and then first generation cephalosporin treated about 15% of cows, and then followed by penicillin. Reproductive disease was the next most common disease reported by producers. About 15% of cows affected, about half of those were treated. Again, third generation cephalosporin, because of that milk and meat withdrawal or lack of, the number one antibiotic used for that. 46% of cows with reproductive disease were on operations where third generation cephalosporins were the primary antimicrobial used. So this graph, again, the third generation cephalosporins just kind of pop out for all the different diseases that are treated in adult dairy cows on dairy operations. Okay, so one of the most common uses of antimicrobials on dairy operations are intramammary antimicrobials used at the time of dry off. So we have 93% of cows, according to producers, were dry treated in 2013. The blue bar is the percent of operations that use that particular product, and the gray bar is the percent of cows that were specifically treated with that antibiotic. So the cefepirins used by over 50% of operations, about 30% of cows treated with that. The third generation cephalosporins, again, about a quarter of operations, about a quarter of cows. And then the combination of Pen-G and dihydrostreptomycin used by about a quarter of operations and a quarter of cows. Okay, so ionophores are really the most frequently used feed additives that we found on dairy operations, and they are not in the medically important category, so they're not affected by either of the new FDA guidance documents unless ionophores are fed with a medically important drug, and then the veterinarian will be involved in writing that script. The critically important antimicrobials are used to treat dairy heifers and cows, primarily the third generation cephalosporins, fluoroquinolones, macrolides, and trimethoprim sulfa. I guess the good news is that they're primarily used for treatment purposes on relatively few cattle. In terms of percents, the problem is when you take that percent and you start putting it into the population of dairy cattle we have in the U.S., that is quite a few cattle, but a fairly low percent of cattle in the U.S. I'd like to acknowledge the participating producers that sat through these grueling surveys for us and filled out the information to the best of their ability. The federal and state data collectors who sat there and begged the producers to provide that data. All the other folks within our group that helps with the design, analysis, and reporting of our survey. And with that, I'll try to answer any questions.
We're reasonably pushed for time, but I'm going to allow to squeeze in one or two questions. I'm sure there are questions given the data set we've just seen. Who'd like to start? Nobody. Well, one here.
Jason, I noticed there was some drugs missing in your treatment for metritis only had penicillin. Did you include ampicillin with penicillin there, or?
Those would all been combined in the beta-lactam group. So we did ask about specific, because we thought producers are going to know what drug they're using, so we gave them the brand names, and then for this analysis we collapsed those down into, with the exception of the dry cow therapy, we collapsed those down into the drug classes.
Okay, and out of interest I have to ask, for your calf diarrhea treatment, were the fluoroquinolones an option?
Fluoroquinolones, they could pick any drug that they wanted off that list, and there were some producers that reported fluoroquinolones. I'm understanding that a lot of those calves probably had pneumonia at the same time, or that's what's getting marked in the treatment record, is that they have diarrhea and pneumonia. I think there still is a little bit of educational component that needs to occur there. The problem is it works really well from what I've heard, and so producers are more concerned about saving the calf than the letter of the law at that point.
Okay, one more question over here.
It's just to ask, some of your figures, although you say they're low in the percentage of treatment, actually some of them are quite scary because they're quite high when you've got 33% third generation calves in mastitis. Have you had any feedback in the public domain when you put these figures out? I mean, how are they perceived? Because you've put them in perspective, but when you put figures out in the public domain like that, they can be taken a different way.
Right. So these haven't been released yet in a public report. One of the things that we try to do when we do put them out is try to put them into context. But ultimately, anybody can go and take those and twist them whichever way they need them to fit their agenda. Good question, though.
Okay, I let the questions run a little bit because this is the penultimate session. And as the chairman, I have the prerogative. I've got the microphone, so I'm going to make a comment now because some of you heard us speaking yesterday at Response Bees. I'm really surprised that in the US so many calves with diarrhea are getting antimicrobials at all, let alone the products we've just heard about. And I think there's some real issues there globally. So that's me on my hobby horse, but I think we'll have to move on and actually go on. We'll take one more question because otherwise I'm hogging the microphone and that's unfair.
In the slide where you showed where the producers got advice on dose, frequency, and withdrawal, do you think that it's a concern that they get the dose and the frequency from other sources than they get the withdrawal? Because it appears as if they looked at the label for withdrawal, but that was not the primary source for dose and frequency.
Well, if I remember back to that slide, it was either the drug label or the label created by the veterinarian or their previous experience with that drug. So whether they had already had that in some kind of computer program that when they put in that drug, it automatically calculates a withdrawal for them. But the three primary resources that they used were the same for the drug, the dose, the withdrawal, and the route. Just a little different percentage of which one was the primary.
Sorry, the concern would be that if you're not using the label dose and frequency, is the label a good place to look for the withdrawal?
Well, probably not, but we didn't actually ask them if they were using it extra label.
Okay, I'm going to stop this
Thank
now. It's very good discussions. I'm sure they'll go on over lunch. Thank you very much.